Hi, everyone. This is Dr. Samantha, and I'm the maternity mentor. Today, with a live stream to answer some of my viewers' recent questions. So, remember to like and subscribe to the channel, and let's get right to it. So, our first set of questions is going to be about antibiotic use. So, one of my viewers writes that she is 23 weeks pregnant and she was given cephalexin 500 milligrams 3 times a day for 7 days. She is wondering if it's safe for her to start a different antibiotic after 2 weeks because that antibiotic did not treat her infection properly and her symptoms worsened. So, the answer is yes, it is safe to switch antibiotics. And in fact, this is very common. Sometimes when you go to the doctor and they test you for an infection, they will send your blood or your urine for a culture. What that means is they take your sample and they spread it on a special dish, and then they'll test your infection against multiple antibiotics to see which one works the best. Using a UTI or urinary tract infection as an example, a lot of times we prescribe a sulfa antibiotic to treat that because they're very effective. However, after a couple of days, if your culture came back and said that amoxicillin was better used for this infection, your doctor might switch you off so the infection can go away faster. And that is very normal, very common. So as long as your healthcare provider is recommending the switch, you can go ahead and do it. And just remember, if you have any questions about whether the antibiotic itself is safe, you can ask your healthcare provider or your local pharmacist. All right, so next question. We have a mom who's 5 weeks and 6 days pregnant. Her doctor prescribed her cefuroxime acetal 500 grams twice a day. And she wants to know, is this medication safe for her baby? So the answer is cefuroxime is extremely safe for use during pregnancy. Now, of course, you always want to check and make sure that that antibiotic is best used for the infection that's being treated. One of the things that I tell my moms, though, is it's very important to take all the medication as prescribed. So a lot of times, 1 or 2 days into your treatment, you're going to find that you're starting to feel better. And because moms don't want to take medication during their pregnancy, they oftentimes feel like, well, since I'm feeling better, I might as well stop because it's better for the baby. That is completely wrong. So you need to take the entire course of the antibiotic in order to kill all of the infection. If you don't, even though you're feeling better, in about a week, you'll actually start to feel worse again. And now this bacteria is resistant to antibiotics, making it harder to treat. So when you're given an antibiotic to take, be sure to take all of it as prescribed by your healthcare provider. Our next mom is 4 weeks pregnant, and she was given the prescription of amoxicillin and potassium clavonate for a dry cough. That prescription was 625 milligrams twice a day for up to 3 days. And she wants to know if this is safe for her pregnancy. So this medication is unique because it's actually mixing 2 different antibiotics at once. And so the amoxicillin part of it is very safe for pregnancy. However, the potassium clavonate does come with some risks. So one of the things I would tell this mom is to talk to her provider and find out if this medication is really the best one to treat her infection, or if there is a safer alternative that she can use. Now, it's very important to treat infections. Infections that are left untreated can lead to miscarriage, preterm labor, and stillbirth. So in the end, it's more important to treat the infection than probably any risks associated with this particular antibiotic. Now, the other thing I'm going to say about this is you want to ask the doctor if you have a bacterial infection. So antibiotics are not going to treat viruses, and oftentimes dry coughs are associated with viruses. So I would want to ask, what infection do I have to make sure that you're being treated properly. If the cough is simply a cough, ask if there are any homeopathic remedies you could use, such as honey, cough drops, and teas. All right, so a very common subject that I get a lot of questions about is bleeding during pregnancy. Bleeding is very scary. I mean, it's the scariest thing that most women will experience. And yet, most people don't realize it's actually pretty common. Now, before we start, it's important for you to know that if you experience any bleeding, you need to make sure that you contact your healthcare provider. Don't be afraid to do so. This is what they're there for. All bleeding should be checked out by them, okay? However, it is good for you to know that there is some bleeding that's normal. So let's get into some of these questions. So the first question comes from a viewer who's 4 weeks pregnant and she's bleeding. And she says she's taken 4 pregnancy tests while bleeding and they're all positive. And so she's wondering if this is even possible. Like, does it make sense? So I'm going to tell you that it can make sense. So that early in pregnancy, there's a lot of reasons why you might be bleeding. For one, this could be implantation bleeding, and her date could be off. A lot of times we think we're 4 weeks pregnant and we're actually 2 weeks pregnant or something like that. So one of the things you need to take into account is that you don't know for sure where you are in your pregnancy. The second thing is that a lot of women will actually have their first period even while pregnant. And a lot of people don't know this, but sometimes it takes one cycle before your body actually starts to get in the groove of pregnancy. Now, there's something called a subchorionic hemorrhage, which I do have a video about. This is a very common occurrence where a little piece of the placenta may tear off and bleed a little bit. A lot of times it's very minor and it won't affect the pregnancy in any bad ways at all. You can go on to have a completely normal, healthy pregnancy and healthy baby. But early on, this may cause some bleeding. And, finally, you can also have bleeding when you have sex. So the hormones that we need to have a healthy pregnancy, one of the things that they will do is they will cause vaginal tissue to kind of dry up and get very tender and thin. And so what happens is when we have sex, even with lubrication, that tissue can tear, and then sometimes it will bleed and bleed enough that you think you are actively bleeding. Okay? So the next question is, would one get a positive urine pregnancy test with a subchorionic hemorrhage? So this mom tested positive with a urine test, and then she started to bleed, but still saw some very faint lines on a positive pregnancy test. She has pregnancy symptoms, but she's waiting for a blood test to confirm. Okay. So the first thing I want to say about this question is let's talk about the urine pregnancy test. If you get the faint lines, they still count. Any faint lines means that you are pregnant, okay? So even if you see blood, that pregnancy test is sensing the pregnancy hormone HCG. Now, again, we just went over some of the causes of bleeding. And yes, you can have a positive pregnancy test with a subchorionic hemorrhage. In fact, most women will get their subchorionic hemorrhage later on in their first trimester, between 8 and 12 weeks. So absolutely, you're testing positive at that time. Again, it may not be a subchorionic hemorrhage that's causing the bleeding, but one of the other causes that I mentioned. Now, this woman mentioned that she was getting a pregnancy test via blood, okay? Blood pregnancy tests are far more sensitive than the urine tests. So what happens with a blood pregnancy test is they are looking for an HCG level, and they compare that number to the number of weeks the woman says she is pregnant. Now, I can't give you exact numbers here. It depends on the week and even the days that you think you have been pregnant for. But one of the things that is supposed to happen is those levels are supposed to rise. So when a woman is bleeding, one of the things that we suspect is a miscarriage. So one of the ways to determine if a woman is having a miscarriage is to do a pregnancy blood test, and then about 3 to 7 days later, repeat that blood test. If the HCG levels are going up, that's a good sign that even though bleeding is present, there's probably also still a live pregnancy. However, if the HCG levels are dropping, that usually indicates a miscarriage. All right, so I also have a question here that has to do with bleeding that says, I'm still having pregnancy symptoms, but I have my period. Why? Okay, so you can be pregnant and still have your first cycle. This happens all the time. It's just your body starting to regulate. In addition, unfortunately, some of the symptoms of our period can mimic a pregnancy. If you think about it, a lot of times we'll feel bloated. We may even feel nauseous. A lot of women get headaches and their breasts will be sore. This is all caused by the same hormones. So the reality is you could have pregnancy-like symptoms and not be pregnant while on your period. The best way to determine what is going on is to retake a pregnancy test or to contact your healthcare provider who might be able to perform an ultrasound. All right, so now we have an interesting question about blood types, okay? So this mom writes that she's O negative and she's had 2 babies. And she took the antibody injection, which is Rogam, after both of them. And so now she's pregnant again, and the test is showing that she has high antibody levels in her blood. And she's wondering what is going to happen. So one of the reasons why we give Rogam is if the mom is Rh negative blood type and her baby happens to be Rh positive. So your baby's blood actually circulates inside your body, which means when your body senses those positive blood cells, it wants to attack them. It thinks that that's a foreign invader that it needs to get rid of. So as a result, your body can actually attack your baby and try to cause the baby to miscarry. That's why we give Rogam to try to prevent that. Now, sometimes your body will still sense that and you will see those antibodies present. So what happens in that case is your provider should send you to a high-risk doctor called a maternal fetal medicine doctor who's going to start to monitor your pregnancy more carefully. They're going to be doing stuff like monitoring the baby's weight and the baby's growth and monitoring the functionality of your placenta to make sure it's feeding your baby properly. They're also going to be checking you often for anemia. If you start to develop severe anemia or the baby's not growing right, then they're probably going to go ahead and deliver your baby early. Otherwise, if everything continues as normal, they will allow the pregnancy to go to full term and there may be no adverse effects for your baby at all. All right. Next one is related to depression. Okay. So depression is very common during pregnancy and postpartum. It's a lot more common than we realize. And there's a lot of risk factors related to having depression during your pregnancy. Untreated depression can lead to miscarriage, stillbirth, and preterm labor. It can also lead to a baby that has failure to thrive and failure to grow properly in the uterus. These babies can come out with blood sugar problems, breathing problems, jitteriness, all sorts of stuff. So it's very important that we help treat mom during the pregnancy, okay? You always want to talk about the risk-benefit analysis of taking any kind of medication, but I want you to know that there are medications that are safe for you to take during your pregnancy. So, first question, is Aldep 10 safe during pregnancy? So, unfortunately for this viewer, this is not a medication that I am familiar with because it's not used here in the United States. So, what do you do if you're not sure a medication is safe? Okay. The first thing is you should be able to have a chat with your healthcare provider who should explain to you why they chose the medication they did and what other medications were available and why they didn't choose those medications. That helps you determine the risks and benefits of the medication they are offering you. Second to that, I suggest you go to your local pharmacist. So, a lot of pharmacists have a different set of information that they know about medications that your doctor may not. They can also counsel you on the risks and benefits of taking that 10 milligrams during pregnancy or while planning for a baby. So, escitalopram is the generic name for the medication Lexapro. And Lexapro is a SSRI, which is a serotonin selective reuptake inhibitor. All that means is it improves sleep with mood. And so that is extremely important for you to have normal levels of in order to feel well. So escitalopram increases those levels when they are low. It's indicated for the treatment of depression, anxiety, panic disorder, and it can even help with a little bit of social phobias and sometimes even obsessive compulsive disorder. Lexapro is safe for use during pregnancy, especially when the benefits outweigh the risks. In fact, it's one of the first go-tos that most of us providers will use. What I want you to know is it's very well tolerated by most moms, and not a lot of it goes to baby. Now, just like I can tell you the benefits, your healthcare provider should do the same, but they should also tell you the risks. So, SSRIs come with one major risk for your baby, and that is withdrawal syndrome. Now, this is not a withdrawal syndrome that causes seizures or requires intensive care. Withdrawal syndrome from SSRIs is a baby who at birth will be a little bit more irritable. This baby may cry more and may need to be held more. And oftentimes, if you just feed them often, they're very happy. Okay. This withdrawal syndrome is simply because that little tiny bit of serotonin that they've been getting is gone now. Okay. They will adjust very quickly and their body will produce the serotonin for them. So, how long will this last? Maybe like 5 days to 10 days at the most. Some babies, you won't even see it at all. It's not a guarantee. But all you have to do is hold your baby and love your baby. And in the end, your baby will have done better for you to have taken that medication if your mood was better during the pregnancy, because your baby will have come out healthier and bigger and ready to go. All right, let's move on to some questions about hemorrhoids. So, hemorrhoids are enlarged blood vessels that usually kind of appear around the outside of the anus or also inside the anus. So, our first question comes from a mom who said she never had hemorrhoids before her pregnancy. She wants to know, will the hemorrhoids be gone after birth or if she has not had them treated? So, unfortunately, the answer is they will probably not be gone. Usually, hemorrhoids, once they appear, they kind of are always there. Now, sometimes the hemorrhoids will shrink back down. It just depends on the mom. But most of us will end up with hemorrhoids for the remainder of our life until we receive some kind of treatment. Now, there are some medications that can be used. So, one of the next questions is it safe to use hemorrhoid cream during pregnancy? So, the answer is generally speaking, yes. Okay, most of the over-the-counter products, the hemorrhoid creams, the rectal suppositories, and the topical pads are safe for use during your pregnancy. And in fact, the Tux pads, which are these topical circle-like pads that you can put on for pain and to help shrink the hemorrhoids, we actually use those after you give birth to lay against the vagina to help heal when you've gotten a cut or a laceration during your birth, okay? So these medications, generally speaking, are safe, but you should always let your healthcare provider know what's going on and check with them. Now, a lot of people might be like, okay, but it's just like an over-the-counter medication. Like, why do I need to do that? Well, among other things, you want your provider to know that you've been having issues with hemorrhoids, because if any of the hemorrhoids tear, that can actually lead to infection. And of course, infection can be dangerous to your baby. Additionally, your doctor wants to know if you have hemorrhoids prior to a vaginal birth, because one of the causes of hemorrhoids is when you strain. So a lot of moms will strain when they're using the bathroom to go number 2 or to have pass stool. And so that is the same type of straining that you see during a vaginal birth when a woman bears down to deliver the baby. So if you have a whole bunch of hemorrhoids that haven't been treated properly, that may interfere a little bit with your birth. So your healthcare provider may want to know ahead of time so they possibly could prescribe a stronger medication. All right, so our next question is about infections in general. So we have a mom who's 22 weeks pregnant, and she's saying that she's having recurrent vaginal infections, and she's wondering what she can do. So the first thing is you need to see the healthcare provider. But what should your healthcare provider be doing? When you go to the healthcare provider with recurrent vaginal infections, they should be swabbing you. So what does that mean? They should be taking a long stick, like a Q-tip. So it's got a cotton end and a long stick. And they should be inserting that into the vagina to get some of the secretions and sending that to a lab to test it. If you don't know what kind of infection it is, you can't possibly treat it properly, okay? There are some sexually transmitted diseases that require you to actually get an antibiotic in the form of a shot in your muscle. A yeast infection would be treated vastly different than say a sexually transmitted disease. So you want to make sure you know what it actually is. And of course, sometimes we think it's an infection and it really is just normal discharge from pregnancy. Now, second to that, you want to make sure that you are doing some things. So number 1, if you have a lot of discharge during your pregnancy, which is sometimes normal, you want to make sure that you're using a pad on your underwear and changing that pad every time you go to the bathroom. Now, just remember, if you start using a pad for discharge, you need to tell your healthcare provider so they can make sure you don't have an infection or that your water hasn't broken. Now, you also want to change your underwear daily. I know this seems silly, but some people don't do that, and it's very important that you do that. At night, you should be sleeping without any underwear on. Your vagina needs to breathe. Our vaginas are moist and wet normally, and that's a great breeding ground for bacteria. What does that mean? That's a great way for the bacteria to grow and to create an infection. So when we go without underwear at night, it allows the vagina to breathe, which can help reduce that risk. You want to make sure you're wiping from front to back when you use the bathroom, and you want to make sure you're showering or bathing daily. These can all help to prevent infections. Now, if you have recurrent yeast infections, one of the things you can do to help is you can take a probiotic. I love probiotics. Probiotics are designed to help your entire intestinal tract, the entire gut, perform properly. And one of the things a probiotic will do is it will also keep your vagina in proper balance. We are supposed to have bacteria inside of our bodies. For example, we have bacteria in our intestines that help us produce vitamin K. In our vagina, there are bacteria there that help prevent and fight off other types of infection. So, in order for us to maintain all of that, we need to make sure that that bacteria is healthy and there's plenty of it. And that comes in the form of a probiotic. Now, let's talk about a question that we got about placentas. So, the placenta is the organ that feeds your baby. It is kind of like a big hamburger. That's kind of what it looks like when you deliver, but it's got the umbilical cord attached to it. And the placenta attaches to the uterine wall, and then blood flows through it to the baby to feed the baby and give the baby oxygen. And then blood flows out from the baby back into your system to remove toxins. And then you excrete those toxins for your baby. So the question is, my placenta is anterior and not low-lying anymore. My baby is head down and I'm 27 weeks pregnant. Can these two positions change before my due date? So, first thing, placenta is anterior. What does that mean? That means the placenta is in the front of the belly. So your uterus is going, it's like a big sac inside your abdomen, okay? And it's got a front, which is towards your belly button, and a back, which is towards your spine. When we say the placenta is posterior, that means it's towards the back. Now, normally this really doesn't have much to do with anything, but sometimes when we're trying to monitor a baby in labor and delivery, if your placenta is anterior, it can make it hard to hear the baby's heart rate. Now, not low-lying. So what does that even mean? So you have your uterus, and at the bottom of your uterus is your cervix, okay? And the cervix is the opening to the vagina, and it's meant to stay closed until you're ready to deliver. Now, your placenta should not fall over that cervix, because if it does, when your cervix starts to open or dilate and the placenta is here, you'll start to bleed a lot. And this can be life-threatening for both mom and baby. So when a placenta is low-lying, that means it's sitting right on the edge of that opening. Now, sometimes when a woman is early in her pregnancy, the placenta will be sitting right there on the edge, or it'll be covering it entirely, which is a placenta previa. But as baby grows, the uterus grows, and that placenta can actually start to migrate up. And so that's where a low-lying placenta will move upwards and turn into nothing at all but a normal placenta. I have never seen this change. I'm not going to say that it's 100% guarantee, but it's extremely rare if it ever happens at all, because the placenta is actually not detaching and moving itself. It can't detach. That's a medical emergency. What's happening is the side of the uterus is just moving away from the cervical opening. The cervix is stationary. It does not move, but your uterus expands like a balloon, and therefore the sides will move over time. Okay? Now, baby is head down at 27 weeks. That's awesome. Unfortunately, that can totally change. So babies at 27 weeks are little tiny peanuts, and they have lots of room to move, and they move a lot. Most moms will say the baby's active all the time and feels like they're doing jumping jacks and flips and all sorts of stuff. It's actually a lot of fun to feel. So yes, can absolutely move from a heads down position to a different position altogether, including transverse, which is lying across, or head up, which is considered a breech position. And now the thing is you don't need to despair. There are babies that will be bottom down or breech right up until the very end. And then all of the sudden they move like a day before you deliver. Or sometimes your doctor can perform a version. So a version is where they use their hands on the outside of your belly to try to manually move your baby. Okay? But the nice thing is about the placenta that should not change. All right. So now we have a couple questions just about pregnancy. So my first question comes from a mom who's asking, is it possible to get pregnant even if sexual contact occurred 7 days before her period? So her menstrual cycle is late and her doctor advised her to come back later on in March if she hasn't gotten her period. So here's what I'm going to tell you. Yes, it absolutely is possible. So sometimes our cycles aren't regular, which means that we may start bleeding even though we just ovulated. Okay. So in that case, if you just released an egg, you could get pregnant and a couple days later be bleeding. Now, some women release more than one egg in a cycle. Okay. So that's another way that you might be able to get pregnant even though you're closer to your period. And of course, let's not forget, this could be implantation bleeding. So implantation bleeding is when you are pregnant, and this is the moment that the fetus is burrowing into the uterine wall, and you'll get a little bit of bleeding. And this can mimic an actual period. So you might think it's your period because it's come on time, and the reality is it's actually that. So what do? You take a pregnancy test, okay? Take a pregnancy test at home to confirm what you think is going on. And if you are testing positive, you want to let your doctor know, and then they'll follow up with a repeat test. Now, let's talk about the fact that this is a mom who's not sure if she's pregnant. What else should she be doing? Okay, so the first thing is, in my practice as a psychiatric nurse practitioner, every single woman of childbearing age, I recommend be on a prenatal vitamin because you don't always know when a pregnancy is going to occur. So this means women starting at the age of 15 all the way until 50, I tell them to take a prenatal vitamin. This is so that you are the healthiest you can be and the healthiest for your baby, just in case. So, next thing, so you think there's a possibility you might be pregnant. What do? Well, make sure you stop drinking alcohol, you stop doing any drugs, and if possible, you stop smoking. All of these things are very damaging to your baby, and the earlier you stop it, the better it is for you, your baby, and your pregnancy. So if you like to drink alcohol, you stop for a couple days, take your pregnancy test, and see what happens. If you're not pregnant, you can go back to drinking if you want to, but it's better to be safe than sorry. All right. Our next question is, I'm 35 weeks pregnant and it feels like my baby has hiccups for 5 minutes. Is this normal? Yep, it is. So babies are like mini human beings that we see walking around all around us, okay? We all get hiccups. They get hiccups. The reason why the baby gets hiccups is because the baby is practicing breathing inside your belly right now. The baby breathes in amniotic fluid and exhales amniotic fluid. This gives the baby a chance to practice the skill of breathing, but it also expands the lungs and helps the lungs to grow. Now, part of the reason why we get hiccups is because we get like a little muscle spasm when we're like breathing on the baby, same thing inside your belly. Now, babies don't really know to do all the tricks that we think help us to get rid of hiccups. So what happens? The baby has hiccups until the hiccups go away. Simple as that. So your baby may have hiccups for just a couple seconds or longer, including up to 5 minutes. Your baby may also have hiccups many times per day and may have them every day. Now, if you're not sure your baby is having hiccups, go ahead and call your healthcare provider and ask them to check the baby. That's what your healthcare provider is there for. They are there to answer any and all questions you have. There is no question that is stupid. There is no question you should hesitate to ask. It's important for you to feel comfortable, and you want to make sure that you are keeping your baby safe, and asking questions is the first way you can do that. Now, our next question is about uterine and pelvic organ prolapse. So this is where the bladder and part of the uterus can fall down and out to the outside. So our mama had an episiotomy in June of 2007, and it wasn't stitched very well, she's saying. She pushed for 3 hours. She became very swollen when the episiotomy was performed. And she wasn't really sure why she was allowed to get to that point. Now, she had 5 other babies after that and developed pelvic organ prolapse from that. In January of 2019, she had prolapse surgery done when her youngest baby was about 8 weeks old. It worked for a short period of time, and then it became undone. And she wants to know what causes that. So this is complex, and it depends on the mom, okay? So I cannot answer specifically for my viewer. However, I can give you some generalities to this. So first of all, it is very important that we space out how often we're having babies. Our pelvic organs need time to heal. The recommended baby spacing is 2 years. And this is 2 years from birth, not 2 years from the time you got pregnant. Your body needs that entire time to allow everything to heal back to normal. When we have too many babies year after year, this can cause a lot of your organs and the ligaments and the tendons and the musculature to stretch and never be able to go back into place properly. That stretching causes them to be weak, and then they can't support your organs. Okay? Now, the next thing is, once you have pelvic organ prolapse, you need to be, well, actually, let me back up. So when you deliver your baby, they give you a whole bunch of discharge instructions, right? And one of them is don't lift anything heavier than the baby. Now, a lot of moms think that that's very silly, especially after like a week or two after they give birth to the baby. They're busy. They're like, I can totally lift this like heavy bag of groceries or this laundry basket. Part of the reason you're not supposed to do that is because you're putting strain on your internal organs. And that causes them to heal properly, okay? And you can get a pelvic organ prolapse very quickly after birth if you don't take care of yourself. So you want to make sure that you are following those directions. This is why you need to ask for help. Make sure your village is around you to help you, because that's going to help prevent stuff like this, okay? They will tell you no sex for 6 weeks after you give birth. Most of the time, they will tell you no heavy exercise for at least 4 to 6 weeks after birth. This is all to help support that initial acute healing. Now, after the 6 to 8 weeks, when your healthcare provider clears you for regular activities, this still doesn't mean that you go back to like 24/7 running around like crazy. It means you follow your body's cues as you get back to normal. Now, if you were like a marathon runner, you're probably going to be running marathons quicker than the average person. But whatever your level of activity was prior to baby, you can't expect at 6 weeks that you're just going to snap back into it. So you listen to your body's cues. But baby spacing is extremely important to allow for the internal organs to do the rest of the healing. Now, for this viewer, it sounds like you had a lot on your plate and you had 6 children that you were running around after. I suspect that is part of the reason why you had some of the issues. I also think that the pelvic surgery was done relatively quickly after your delivery, okay? And so I think some of this may have been part of the issues that you had. But again, without knowing your specific health history, it's hard for me to say. Overall, mamas, you need to listen to the advice that your doctors are giving you, okay? Bed rest is not always necessary. And in fact, we use bed rest too much and it can be very unhealthy for you. But taking it easy is definitely preferred when you're healing. All right. So now we have a question about water for formula. Okay. So what's the difference between one brand of purified distilled water from a different brand? Is there something different about water that makes it specifically made for babies? Okay. So one brand from another, there's no difference that I know of. If it's distilled, it's distilled. If it's purified, it's purified. There are certain guidelines that allow a company to use those terms. So really, it's just a brand name. That's all it is, okay? Now, as far as is there something special for a baby? There really isn't. The only water that is for babies is sometimes what's called nursery water. And nursery water is where you get like it's like water that has fluoride added to it, okay? And so that fluoride can help with the dental care of your baby. But before you use that water, you should actually talk to the pediatrician because a lot of water in the United States, it actually has fluoride added to it. So if you're using water from your tap and you're just boiling it, then your baby may get too much fluoride if you also use nursery water. All right, so we're getting close to the end of our live Q&A. So I want to make sure any of you that are out there, please add any questions that you might have to the chat so we can get to those as well. All right, so we're in our final category here, which is yeast infections. So unfortunately, yeast infections are very common during pregnancy. That's because the vaginal pH changes due to the hormones that you need to maintain a pregnancy. Now, in addition, unfortunately, women are very prone to urinary tract infections during pregnancy. And this can be for a variety of reasons, but most commonly it's because the baby's head sits on the urethra, which is the part that empties the bladder it goes from the bladder out to the outside for you to pee. And when the baby sits there, it blocks you from being able to pee fully, which is why you have to pee all the time. But it allows for urine to sit inside and you develop an infection from the bacteria that's there. So you get a urinary tract infection and your doctor gives you an antibiotic. Well, that antibiotic can cause a yeast infection because it kills off some of your good bacteria. Okay. So now we have a yeast infection. What do we do? So our first mama says, can I use Monistat 7 for yeast infections and UTI infection at the same time? All right. So the first thing you need to know is that you want to make sure that you are asking your doctor first before using any yeast infection medication. Generally speaking, the medication over the counter is safe. However, some of them do come with a few risks, and so your doctor may have preference for one anti-yeast medication versus another. Additionally, she uses the term Monistat 7. Now, Monistat is a brand name that a lot of women are familiar with. They do a lot of yeast infection products, but there's different forms. For example, there are creams and there are suppositories. Now, your doctor may not want you to use, for example, a suppository because a suppository requires you to insert your fingers inside the vagina. And there may be reasons why your provider does not want you to do that and instead would rather you use an applicator. So you want to make sure your doctor is on board. Now, the other thing is you might think you have a yeast infection and what it really is a bacterial infection. So your provider needs to know what's going on because they probably want to do what I mentioned earlier, which is the culture to make sure that's what it is. Now, going to the second part of this question, can you use Monistat 7 for a yeast infection at the same time as a urinary tract infection, right? So they can be used together, meaning an antibiotic for the UTI and a Monistat 7 for the yeast infection. Absolutely, there's no reason that they can't be. But what I do need you to know is Monistat 7 will not treat your urinary tract infection, okay? It's not an antibiotic, and it will not help that. So you cannot use that as a homeopathic remedy for a UTI. UTIs can be very serious. They're one of the most serious infections you can get while you are pregnant. So if you think you have a urinary tract infection and you have not seen your healthcare provider, you need to do so immediately. However, if you've already been diagnosed and they're giving you treatment, yes, you should be able to use a yeast treatment at the same time. Now, our final question, and this is also about yeast. I have Candida thrush. That's just another way of saying a yeast infection. I'm currently 10 weeks pregnant and I'm taking, and I apologize if I mispronounce this, clotrimazole, okay, 500 milligrams. That's a medication that's used, it's a fungal medication, okay, and that treats yeast. So is it normal to have light pink discharge and then later on the next day, just light blood spotting with bits of brown clot, and the next day it turns to darkish brown spotting? Okay. So the answer is no. That is not normal. You need to contact your healthcare provider immediately. When you have a yeast infection, sometimes you will have a light pink discharge. If you see any pink or red, you always call your doctor. Let me be very clear about that. But let's explain why that can be normal. The light pink can be normal because the yeast infection makes the vagina almost like raw. It gets very irritated. The tissue's already thin and it tears very easily. So as you're getting treatment, you may see a little bit of tiny bleeding resulting because you're just so irritated down there, okay? And that will go away as the treatment starts to work. However, what I want my viewers to know is that that progression that was described very much sounds like a potential miscarriage, okay? Yeast infections, as well as all the bacterial infections, may lead to miscarriage, okay? That's why it's very important if you're having any kind of symptoms of an infection or any kind of discharge, you let your provider know so you can receive treatment right away. Now, when you have any kind of active bleeding, it can go from pink to red to brown. Brown is usually an indication of old blood, okay? Blood that has stopped bleeding, okay? That's a good sign if we're looking to make sure bleeding has stopped, but you always want to let your provider know if they're not already aware. All right, so let me see if we have any questions in our chats. Okay. All right. So I have a question which I answered something similar, but I'm going to answer it again because I'm very glad that you asked. So amoxicillin and potassium clavonate 150. So yes, those can be taken early in your pregnancy. That is a very common antibiotic that's used. It's actually a combination antibiotic. So it's usually used when you have a very serious infection that they want to make sure it gets treated right away. Now, one of the things I want to reiterate, when you have a bacterial infection and you start to take antibiotics, within like a day or two, you're going to feel better. You're going to be like, oh my God, my infection, it's like gone. You still need to take all of the medication. If you stop your medication early, that can actually cause the infection to come back. It'll usually come back about a week later and it'll be far worse than it was the first time. Additionally, because the medication wasn't completed, that infection may actually become worse and the antibiotics may not work well, which means they have to use stronger medication, which actually may be more harmful to your baby. So you want to make sure that you take all the medication as prescribed. Now, if your symptoms are getting worse, or if at the end of the treatment you are not feeling better and your symptoms are still there, you want to make sure that you tell your healthcare provider immediately, because infection can lead to complications like preterm labor. Okay? Let me see if there's anything else. It looks like I might have another question coming in. Let me see. While we're waiting, I want to make sure you guys know that I'm going to be going live on Mondays at 9 p.m. Eastern Standard Time here in the United States. So please make sure that you tune in. And what we're going to be doing is we're going to be taking questions that we're receiving on our videos from our viewers, and we're going to answer them here so that everybody can benefit from learning from some of those questions. Because a lot of you guys have very similar questions. You have similar experiences, similar concerns, and it's oftentimes really nice to see that other people may be thinking or asking the same questions that you already have. So please be sure to include in the comments on the videos any questions you might have. I also want to make sure that you are liking and subscribing to the channel. Okay. We have additional content on Facebook, Instagram, and Twitter. So feel free to also find us on our social media platforms. Okay. And just remember, we're trying to post videos at least twice a month. We usually post them on Tuesdays. And make sure to share all of this information with your friends and your family. So it looks like that we don't have any other questions coming in right now. So I want to thank you for coming to this live, and be sure to see us next week when we're here at 9 p.m. Eastern Standard Time. Thank you so much for joining us at the Maternity Mentor.